Okay, so good day, sir. I'm Pinagaya Narhani S. And today I will going to demonstrate the health assessment and physical examination assessing the assessment of head to toe. So the definition is health assessment. It is collection of data about an individual's health. Physical examination. It is a head to toe review of each body system that offers objective information about the client and allow healthcare provider to make a clinical judgment. And the purpose is health assessment to make a clinical judgment or diagnosis about the individual's health state or condition, to obtain baseline data about the client's functional ability. Physical assessment for routine screening to determine the client eligibility for health insurance, for acquiring a new job, for client admission to the hospital. So the equipment are PP apparatus and thermometer. Watch with the second hand and pen light. Depressor and percussion hammer, weighting scale and measuring tape for measurement, and lastly the calculator for BMI. So the first procedure, general survey, identify and explain the procedure to the patient, rationale to reduce anxiety and promote cooperation. So good day ma'am, what's your name po? So I'm Nurse Honey. So today, assess ko po kayo from head to toe. So general survey muna tayo po ma'am. So next is observe appearance, age compared to state age. Dress, grooming, and hygiene, body fluid. Rationale, observing the general appearance may provide a diagnostic clue to illness. So, ma'am, before you go here is, naligo po ba tayo? Okay po. So, next is take body measurement, composed of height and weight and BMI. Rationale, to have client baseline data. So, ma'am, sa timbangan po tayo. Okay, so sa po tayo sa so po tayo. So next is take the client vital sign composed of blood pressure, pulse rate, respiratory rate, temperature rate, and pain scale. Rationale, taking the initial vital sign will serve as the baseline data for the future comparison. So, ma'am, kukunin po natin yung temperature nyo po, pati blood pressure, tsaka respiration po. So, and while waiting, we're gonna take her pulse rate and respiration rate. Okay, so the pulse is 61 and the respiration is 20. So, well, di pa nagdidip yung thermometer, we're gonna take her, hinagbeat na pala. So, 36.4. So, ma'am, ang blood pressure niyo po. Okay, so ma'am, 80/60. So after taking the vital sign, next is conduct physical examination from head to toe, cephaloquadal using the 4 skills in assessment with composed of inspection, palpation, percussion, and auscultation, rationale to assess, determine, and identify abnormal finding in the body system. So ma'am, mahiga po tayo sa bed. So, first is assessing the skin. So, inspection of skin color, rationale, varies from light to deep brown, uniform color. Next is inspection of skin lesion, rationale, freckles, some birthmarks, some spots, and raised navy moles, umbration, or other lesions. Next is palpation of skin moisture. So, rationale, moisture in skin fold and axilla varies with environmental temperature and activity. Next is palpation of skin turgor. Rationale, when pitched, skin spring back to the previous state. Next is inspection of nail texture. Rationale, smooth texture. Next is inspection of nail plate shape. Rationale, convex curvature angle between nail and nail beds. So next is inspection of nail bed color. Rationale, heavily vascular and pink in light skin client. Dark skin client may have brown or black pigmentation. Next is check for capillary refill time. The method is for palpation. So Rationale, result should be less than 2 seconds. Next is assessing the head. So, inspection and palpation of hair, evenness of growth over the scalp, rationale evenly distributed. So, next is texture and oiliness, rationale, silky and resilient hair. So, the method is inspection and palpation. Next is thickness and thinness. Rationale, hair should be thick. Next is infection and infestation or lice. Rationale, no infection of infestation should be noted. Next is assessing the skull and face. So, assess the skull for size, shape, symmetry, masses, nodule, and diffraction. So, the method is inspection and palpation. So, rationale, rounded, normocephalic, and symmetric with frontal, parietal, and occipital prominences, smooth contour, smooth absence of nodule and masses. Next is symmetry of facial movement. So, instruct the patient to raise eyebrow, smile, frown, and fat the cheek. So, the method is still inspection. So, rationale, symmetrical facial movement. So, ma'am, raise your eyebrow po. Okay, so smile a bit. Okay. So, next is assessing the eye structure and visual equity. So, inspect the eyebrows for hair distribution. So, the method is still inspection. Rationale, hair evenly distributed, skin intact, symmetrically aligned, and equal movement. Next is eyelids, ability of blinking. Rationale, lids close symmetrically. So, it is still, the method is still inspection. So, ma'am, blink po tayo. Okay. So, next is conjunction. Lining the eyelids by reversing the lids. Rationale, shiny, smooth, pink, or red. So, cornea, clarity, and texture. Rationale, transparent, shiny, smooth, detail, or iris are visible. Ma'am, steady po yung eyes natin, open. Okay, so next is pupil for color and symmetry of size. Rationale, black in color, equal in size, normally 3 to 7 mm in diameter, round, smooth border, it is flat and round. Ma'am, steady po tayo, nakadilat. Next is pupil reaction to light. So, we will gonna use pen light. So, illuminated pupil constrict, direct respond, non-illuminated pupil constrict. Next is reaction to accommodation. So, pupils constrict when looking at the near object, pupil dilated when looking at the far object, pupil converge when near object is moved near the nose. So, ma'am, look po tayo dito. Okay. So, next is assessing the ear. So, auricles, color, and symmetry. Rationale, color, same as facial skin. So the method is inspection and palpation. So next is oracle for elasticity areas for tenderness. Rationale, mobile firm and not tender. Pinya recoil after it is folded. Excuse me. So next is hearing acuity. Clients respond to normal voice tone. Rationale, normal voice tones audible. So the method is inspection and palpation. So ma'am, repeat what kung ano yung sasabihin ko ha. 1, 2. Okay. So next is clients respond to whisper, voice, non-consecutive numbers. So ability to repeat non-consecutive numbers. 1, 3. 1, 3. Okay. So next is assessing the thorax and lungs. So shape, symmetry of the thorax from posterior and lateral view. So it is inspection. So symmetrical, rationale, symmetrical chest. Excuse me. So next is palpate the posterior thorax. The method is palpation. So skin intact, uniform temperature. So next is assessing the nose. First is external nose for any deviation in shape, size, or in color, and flaring or discharge from the nares. So the method is inspection. The rationale is symmetric and straight, no discharge of flaring, uniform color. Next is external nose external nose to determine any areas of tenderness, masses, and displacement of bone and excuse me, bone and cartilage. The method is palpation. So rationale, no tenderness, no lesion. So next is patency of both nasal cavity. Rationale, air movement is restricted in one or both nares. Next is assessing the mouth and oropharynx. So first is lip and buccal mucosa. So it is the method is still inspection. So uniform pink color. So next is teeth and gum. Rationale, pinkish gum, smooth white shiny tooth enamel. So ma'am, patingin ang teeth niyo po. Yung gum. Okay. So next is tooth, inspection of tongue or floor of the mouth. So rationale, central position. So ma'am, yung tongue niyo po. Okay. Next is tongue movement. Rationale, moves freely, no tenderness. Next is oropharynx and tonsil. Inspect the oropharynx for color and texture. Rationale, pink and smooth posterior wall. Ma'am, open yung mouth po. Open yung mouth. Okay. So next is assessing the neck. So inspect the neck muscle. So the method is inspection. Rationale, muscle equal in size, head centered. Excuse me. So next is observe the head movement. Rationale, coordinated, smooth movement with no discomfort. So ma-move yung head natin left and right. Okay. Next is palpate the thyroid gland for smoothness. Rationale, lobes may not be palpated and the method is still palpation. Okay, so next is assessing the thorax and lungs. So shape excuse me. Shape symmetry of the thorax from posterior and lateral view. So the rationale is symmetrical chest and the method is inspection. Next is palpate the posterior thorax. Rationale, skin intact, uniform temperature. So the method is palpation. Next is palpate the posterior chest for respiratory excursion. So rationale, full and symmetric chest expansion. When the client take a deep breath, your thumb should move apart in equal distance and the separated 3 to 5 cm. Next is anterior thorax, inspect the breathing pattern. So rationale, regular rhythm rate 16 to 20 per minute. Next is breath sound. So the method is auscultation. Normal breath sound, vesicular, vesicular, and the bronchi. Next is auscultate the client in all four anatomic sites composed of aortic, pulmonic, tricuspid, apical or mitral. In every areas of auscultation, distinguish both S1 and S2 sound. So the normal beat is 60 to 100 beats per minute. S1 and S2 must be heard in all sides.